So Dr. Swartz completed his training and his neurology residency at the University of Toronto, and his appointments and affiliations include being a stroke neurologist at Sunnybrook Health Sciences Center, an associate professor in the Division of Neurology, Department of Medicine at U of T, and directing the Sunnybrook Stroke Research Unit. He's also the medical director of the Northeast GTA Regional Stroke Network and the director of the University of Toronto Stroke Program, and also the co-lead of the ONDRI study. So welcome, Rick, and go right ahead.
Thank you very much, and thank you to those of you who have attended all morning. It's been an amazing morning. I apologize, I've had to be a little bit in and out. I'm in the hospital on stroke call today, so hopefully my pager doesn't go off in the next few minutes. Well, we kind of bring this home, showing you a little bit about HANDS Ontario and the study itself. And really hopefully bringing together a lot of the science and background that you've heard this morning as to why we're doing this and what its potential impact may be. So the HANDS Ontario study is looking at health in aging, neurodegenerative diseases, and dementias in Ontario. And we use the hand metaphor in part because there's a number of worldwide studies that use that part of the anatomy. Several years ago, there was a finger study that looked at vascular risk reduction and exercise and activity in reducing dementia. And since that time, there's now a worldwide fingers effort. There's the CAN thumbs up study, and the hands study is really fitting into that analogy, but it also is an apt description of what we're doing. We are part of ONDRI, which you've heard about today. And just to remind you from flashing back to Mario's introductions this morning, really this is what we're for. What all of the scientists and physicians that you've heard from today are devoted to improving the diagnosis, prognosis, care, and outcomes for people living with neurodegenerative diseases, stroke, and dementia. And we're really looking at the cross-disease, cross-platform commonalities. So looking at not just what drives vascular cognitive impairment or cognitive impairment after stroke, but what may contribute to, as we heard about, those co-occurring, those comorbidities, as you just heard about here, and again, what Dr. Masalis spoke about earlier this morning, the overlap between Alzheimer's and stroke, or FTD, or Parkinson's and Alzheimer's, or ALS and FTD. All these diseases interact, and our categories, we think of these as discrete boxes, but they're really much messier than that. And really, the initial foundational study that looked at all these biomarkers that Dr. Munoz was talking about has provided a foundation that we can build on in HANDS Ontario. And HANDS is really designed to build on what you've heard: remote sensor technology, wearable devices, genetic and molecular biomarkers to really help us make discoveries on multiple levels across the basic science, individual function, and health system levels. And you've heard a little bit about all of those today. And HANDS is really designed to try to understand how these different diseases affect people, how they may interact and overlap, how we might be able to get markers to help us diagnose better, but also to help us individualize management. And Dr. Masalis was alluding to that kind of complexity and the need to make things individual. I think you saw that also in Dr. McElroy's presentation when he was showing just the walking patterns for different people. We really need to target individual health behaviors, but potentially in the future, individual therapies. And HANDS is really designed to look at all those different levels of what we're intervening on, how we can intervene to make somebody's day-to-day activity better, and how we might be able to use the health system and use interventions to improve outcomes for populations. So what does HANDS really mean for a person? What are we asking people to do? It's designed, and I want to emphasize that this was designed before the COVID-19 pandemic. And before equity, diversity, and inclusivity, EDI was a whole big thing over the last few years, and importantly so. But it was designed with those ideas. It was designed to get out of the lab, to get to the community, to get to the home, to get to where people are living with these diseases. And it was designed to be more accessible geographically, socioeconomically, for people who may not be able to get into large academic centers or take large amounts of time off of work, because it's designed to be done from your home with remote assessments, telephone calls or video calls, mail out, mail back samples. There's one in-person visit that's a lab test, which I'll show you in a second, but it starts with a screening and informed consent. So we do this by phone or by computer, and our coordinators call people who express interest to their doctors or off our websites or after talks like this, or are referred from friends or family. And they'll go into detail about the study. There are multiple study visits spread out over time, so you don't have to get worn out at any one visit. And it's about an 8-week arc, as Dr. McElroy was telling you earlier. We mail out sensor packets, the 3 sensors, the wrist, the chest, and the ankle that he was speaking about. And that's worn for 7 to 10 days. And it's sort of a 10-day period. And there is that opportunity to take it off if you're, well, I don't know, if Omicron settles down and we're ever going out for nice dinners again, and you want to not have to be wearing sensors for an evening, there's that opportunity to disconnect for an evening as part of that 7 or 10, that 10-day cycle. But we're looking for at least 7 days of continuous wear. And the blood sample can be given at any Life Labs anywhere in Ontario. And so it's quite accessible. Doesn't have to come into an academic center, don't have to attend at a hospital. You can make an appointment, again, at your own convenience. And then completing the assessments and questionnaires by phone and online. Pardon me, near the end of the study, as you saw from Dr. McElroy, we're producing personalized health and activity reports with the Health Canada approved outputs from these devices so that we have evidence behind them. And then we're seeking our volunteers' feedback on how to make the information that they get the most useful and most productive it can be. The feedback forms that we're giving are already tremendously informed by almost 100 volunteers already, and by our Patient and Community Advisory Committee, our PCAC, to be hopefully useful now. And we want to continue to iterate that to make it more and more useful, and maybe even work towards giving feedback forms for physicians that can help with management. So this is really a partnership with our PCAC. And the Patient Community Advisory Committee has been instrumental in really developing this study in general and in launching it. And one of the people that we have with us today, Mr. Larry Linton, has been a very active member of our PCAC, our Patient Community Advisory Committee. I'm going to introduce him now, and we'll ask him to say a few words. Larry is an immigration lawyer by trade, having been trained in his native South Africa and then reestablishing himself in Canada following his own immigration. He was diagnosed with Parkinson's in 2012 and found the first 2 years after his diagnosis very challenging. He felt withdrawn from his family and found it easier to deny what he had. But after an existing initial phase of denial, Larry found that some acceptance with his diagnosis. And with that acceptance, he literally got off the couch and reclaimed his life, which has, he says, in many respects, become more rewarding, fulfilling, and meaningful than at any time before his diagnosis. He added author and musician to his long list of achievements after his diagnosis, and is currently the chair of Parkinson's Canada's Parkinson's Advisory Council. And as I mentioned, part of ONDRI's Patient and Community Advisory Committee, advocating not just for persons with Parkinson's disease, but across the neurodegenerative and stroke spectrum. By sharing his story, Larry hopes to inspire others to live their most authentic and best lives with Parkinson's and neurodegenerative diseases as well. And we're thrilled to have him here. So thank you, Larry, for joining us.
Well, thanks, Dr. Swartz, for that introduction. I just want to make sure that you can all hear me. Great. The day of my diagnosis 10 years ago was the start of a very dark chapter that saw me withdraw from my family, my friends, my work colleagues, until I was living on the couch, literally. But 2 years later, after going through the other stages of grief, I finally reached the point of acceptance and started living with the disease and no longer against it. I started to reclaim my life, to reinvent myself, and to regenerate a life that was worth living again. I returned to my love for drumming. I started running and reached the professional milestone of partner admission 4 years after my diagnosis. But I've come to realize that it's just as important to look to the future. COVID has forced us all to do the same. Our lives have fundamentally changed over the past 2 years. We live differently, we work differently. And it has made us look into the future too. Before COVID, I used to arrange my follow-up appointments with my specialist in the early mornings when I was on, both physically and mentally. I was hoping to show him how well I was doing, that I was beating this thing called Parkinson's. For the short time that we had together, I didn't mention the subtle changes that I was becoming aware of. Instead, I highlighted the long hours I was still working and downplayed some cognitive symptoms that I was starting to experience. But with COVID, the delivery of healthcare has changed. Telehealth has brought healthcare delivery into the home environment by connecting us with our medical professionals via Zoom, just like we are doing today. Instead of relying on historical information and home diaries, telemedicine has allowed us to engage with our professionals in our own environment in real time, putting us at the center of our own care and management. Rather than focusing on our concerns, this approach considers us, the patient, as a human being in a social and geographic environment. For me, it has essentially invited those in my circle of care into my daily life to see me in a more authentic and genuine state, and has allowed me to be vulnerable in dealing with the progression of the disease. ONDRI's mission of embedding research into care and care into research is another important step into the future. And having been a participant in the HANDDS-ONT study is another great example of how care can and will be delivered in the future. As you've all heard today, the study has three main components, looking for blood-based biomarkers, symptoms and behavior tracking and reporting through wearables, and the long-term disease trajectory. Over the course of 10 days, I wore the chest monitor and wrist and ankle sensor. I did experience some difficulty with attaching the chest monitor. I had trouble peeling the adhesive tape off. It's a bit of a challenge with tremors in your dominant hand. So I'd recommend that the adhesive tape maybe be wider. It would be easier to hold onto and strip away. The sensors in combination track my sedentary behavior, my physical activity, my sleep patterns, and nighttime behavior. Unfortunately, I lost the ankle sensor somewhere on a 100-kilometer bike ride. But I promise you I completed the ride, but I couldn't find the sensor. I found the devices generally easy to wear. My one recommendation is to make them all waterproof so that they can be worn continuously throughout the monitoring period. I was satisfied with the overall results that came through a review of a personalized health activity report and found my sleep patterns and nighttime behavior quite revealing. I now know why my wife sometimes looks as exhausted as I do in the mornings. The research team was great. They were engaging, accessible, and helpful, even remotely. The feedback sessions were informative and helpful. They really care about everybody's experience and the feedback and are working hard to make the research better and better. As a person living with Parkinson's, obviously the first prize is to find a cure and to talk about having had Parkinson's. But until then, the next best thing is to be able to live with it and maintain a good quality of life for as long as possible. We live with the disease every day, every hour. Efforts like the HANDDS-ONT study go a long way to empowering us to take control and be an active participant in the management of the disease instead of being a passive recipient. I'm thankful for having had the opportunity to participate, and my hand is firmly up in the air to participate again. So thank you very much.
Thank you, Larry. That's tremendous. We really appreciate both your participation in HANDS, your participation in the PCAC, and your willingness to share your experiences with us today. We just so very grateful for your collaboration. And I think with that, we'll leave the chat open and have the last couple of minutes with questions. I'm going to emphasize that HANDS Ontario is open to adults living independently with no diagnosis. So oftentimes that's partners and family members of participants. Some couples are enrolling as a family activity. Individuals with MCI, mild cognitive impairment, Alzheimer's, Parkinson's, ALS, frontotemporal dementia, stroke. It's a broadly inclusive study. And I'm going to leave the contact information up here, cell phone numbers, emails, You can check out the study on our website. And I just want to thank all of our speakers today for a really engaging and hopefully interesting and valuable day. So to Dr. Masellis, to Dr. Munoz, to Dr. McElroy, to Drs. Bronskill and McLaughlin, and to Larry for joining us. Thank you very much, and thank you all for your attendance today. This is we're really excited to have this. For those who want to, it will be recorded and available, and we'll make some of the snippets also available more publicly, I suspect. And if anybody has questions or comments, we're happy to keep the speakers on the line. Thank you again, everybody.